I'm Dr. Gonzalez, and today in this video we're talking about the following topics.
In the muscles of facial expression, basically almost all of your muscles of facial expression are innervated by the cranial nerve number 7, the facial nerve. This facial nerve has several branches, including a temporal branch, zygomatic, buccal, marginal, and the cervical branch. So the first muscle is the one indicated here in red and blue. Particularly red is the area where the muscle fibers are located. Blue is the aponeurosis. So this muscle is called the occipitofrontalis. Other books also call it the epicranius. It has two bellies, a frontal belly and an occipital belly. In this view, you're looking at the frontal belly. This muscle has an origin at the epicranial aponeurosis and an insertion in the skin and subcutaneous tissue of the eyebrows and forehead. And the action is to elevate the eyebrows and wrinkles the skin of the forehead, particularly whenever a person is surprised.
Origin in the epicranial aponeurosis. Insertion in the skin and subcutaneous tissue of the eyebrows and forehead.
Second muscle is the Aricularis Oculi, which is this one you can see right here. The origin is on the medial orbital margin, medial palpebral ligament, and the lacrimal bone. The insertion is in the skin around the margin of the orbit or the eyelid, in other words. And the action is to close the eyelids, particularly the palpebral part, which is the lower portion, is there to close very gently the eye. Meanwhile, the orbital part, which is the superior portion, it closes the eyelids tightly, and it also works during winking.
Medial orbital margin and lacrimal bone.
The third muscle is the Corrugator Supercilia, which is this muscle that's right here. And this muscle, the origin is at the medial end of the superciliary arch. The insertion is the skin is superior to the middle of supraorbital margin and the superciliary arch. And the main action is to draw eyebrows medially and inferiorly, creating vertical wrinkles above the nose, demonstrating concern or worry, and also when the person is mad.
Medial end of superciliary arch. Origin for the Corrugator Supercilia.
The fourth and fifth muscle here is the procerus, which is this muscle right here, and the transverse part of the nasalis. Nasalis is this muscle right here. So the origin is going to be the fascia aponeurosis. That's covering the nasal bone and lateral nasal cartilage. The insertion is going to be the skin of the inferior forehead between the eyebrows. And the main action is to depress the medial end of the eyebrow. And it also wrinkles the skin over the dorsum of the nose, like when you are conveying something that you dislike.
Nasal bone.
Number 5 is the alar part of the nasalis, so right here, and the Levator Labisuperioris aleque nasi, which is this one right here. So the origin of these muscles is on the frontal process of the maxilla, inferior medial margin of the orbit, and the insertion is the major alar cartilage, and the action is to depress the ala laterally, dilating the anterior nasal aperture, such as in flaring the nostrils during anger.
Origin for nasalis. Frontal process of maxilla.
This muscle right here, is also known as the oral sphincter, and the origin is the medial maxilla and mandible, deep surface of the perioral skin, and angle of the mouth. The insertion is the mucous membrane of the lips, and the action is to tone closest of oral fissure. It also has a contraction, and it compresses or protrudes the lips, such as in kissing, or resists the distension when blowing. Number 7 is these two muscles, Levator Labisuperioris, which is this one right here, and the Cygmaticus Major, which is this one right here. For the Levator Labisuperioris, the origin is the infraorbital margin or the maxilla. And for the Cygmaticus Major, the origin is the anterior aspect of the zygomatic bone. In terms of the insertion, both of these muscles, they insert in the skin of the upper lip. And the action for these muscles is to they are part of dilators of the mouth. They will retract or elevate and or invert the upper lip, and they will deepen the nasolabial sulcus, as in showing sadness.
The origin for the Levator Labisuperioris is the maxilla, and the origin for the Cygmaticus Major is the zygomatic bone.
Muscle number 8 is the Vaccinator, which is a cheek muscle. The origin is the mandible alveolar processes of the maxilla and mandible, and the pterygomandibular raphe. The insertion is the angle of the mouth and the Aricularis oris, and the action is to press the cheek against the molar teeth. It also works with the tongue to keep the food between the occlusal surfaces and out of the oral vestibule, and it also resists distension, such as when blowing.
Alveolar process of maxilla, origin of Vaccinator.
Next is the Cygmaticus Major. The Cygmaticus Major is this muscle right here, and the origin is the lateral aspect of the zygomatic bone. The insertion is the angle of the mouth, and the action is part of dilators of the mouth. It elevates the labial commissure, and it bilaterally affects the elevation of the labial commissure, like when you're smiling or in happiness, and unilaterally to sneer.
Zygomatic bone, the origin of the Cygmaticus Major.
Next is the Levator Angularis, which is this muscle right here, deep to the Cygmaticus. The origin is the infraorbital maxilla. The insertion is the angle of the mouth, and the action, part of dilators of the mouth. It widens the oral fissure, as when grinding.
Infraorbital maxilla.
Risorius is this muscle right here, and the depressor anguli oris is this one right here. These two muscles, they have an origin on the parotid fascia and both skin. This is mostly the risorius, and the depressor anguli oris has an origin on the anterolateral base of the mandible. Both of these muscles have an insertion in the angle of the mouth, and both of these muscles are part of dilators of the mouth. They depress the labial commissure bilaterally to frown during sadness, and also the risorius can draw the corner of the lip laterally.
Anterolateral base of mandible, origin of the depressor anguli oris.
Next is the depressor labii inferioris. The depressor labii inferioris is this one right here. The depressor labii inferioris has an origin in the platysma and anterolateral body of the mandible. It has an insertion in the skin of the lower lip. And in terms of action, the depressor labii inferioris, it's a part of the dilators of the mouth. It retracts or depresses the mouth and or everts the lower lip, as in pouting or sadness. The mentalis is this muscle right here, and the origin is the body of the mandible. The insertion is the skin of the shin, and the main action is to elevate and protrude the lower lip, and it also elevates the skin of the shin, like showing doubt.
Body of mandible.
Last but not least is the platysma, which is this muscle right here. The origin of the platysma is the subcutaneous tissue of the infraclavicular and supraclavicular regions. The insertion of the platysma is the base of the mandible, skin of the cheek and lower lip, and angle of the mouth, particularly on the Aricularis oris. And the action is to depress the mandible against resistance. It tenses the skin of the inferior face and neck, conveying tension and stress.
Insertion of the platysma after base of the mandible.
Alright, that is it for this video. Thank you for watching. Don't forget to subscribe, like, and share. And if you have any comments or suggestions, you can leave them on the comments section. Also, don't forget to check out my Etsy store, Queen Mary Anatomy. That is it. I'll see you next time.